Hello, everyone. It's March 3rd, Wednesday. You know, I shouldn't. You know, I've got a memory almost like an elephant, to tell you the truth. But it's unique. But I always remember March 3rd. There's a couple of my friends that I grew up with. You know, right down the street from where we grew up. We played ball together all the time. Did everything in the world. But one was Jimmy Knapp and the other was John Perdue. And Jimmy's wife wrote in, you know, about, you know, that this is the most unbelievable thing in the world, but Jimmy's going to be 70 years old as well as John today. And so I wish them both happy birthday and tell them, you know, that all the unbelievable times that we had, you know, just doing everything, growing up, just as kids would grow up and everything, and all the sandlot football games in the yards and the wiffle ball, baseball games that we had, and just all the kick the can in the alley in the night and all the stuff that just great activities for kids growing up. It was incredible, you know, growing up period. And so we were all three Crescent chipmunks, and so at the elementary school. So anyway, I always remember March 3rd. You know, it's really odd, but I do. Now, you know, the good thing about today too is just this: is, you know, we have only lost 9 more people, and that's not good, and surely most of the ways. But if you're looking at these numbers and how West Virginia is doing, it's still real progress. The sad part is we've now lost 2,309 great West Virginians, and we lost 9 since Monday, and that's not good in many ways. But at the same time, you know, if you're looking at the overall numbers of where we've been and everything, it's moving in the right direction. You know, our 2,301st death was a 58-year-old male from Hampshire County. Our 2,302nd death, a 53-year-old female from Lewis County. Our 2,303rd death, a 66-year-old male from Mason County. Our 2,304th death, a 69-year-old male from Berkeley County. Our 2,305th death, an 80-year-old male from Tucker County. Our 2,306th death, a 64-year-old male from Boone County. Our 2,307th death, a 78-year-old male from Kanawha County. Our 2,308th death, a 60-year-old male from Marion County. Our 2,309th death, a 37-year-old female from Monongahela County. Gracious goodness. We've got a lot of people in this group right here, a 58, 53, 66, 69, 80, 64, 78, 60, and 37-year-old. A lot of people that have gone way too soon. And, you know, another note that I have here is in the last 7 weeks, we have decreased, our deaths have reduced by 85%. It all sounds great, doesn't it? But for these 9 great families and great people, you know, it's tragic beyond belief. Now, what can we do? Well, we've got to keep moving and keep going north. We have to, don't we? There isn't any other choice. But at the same time, we can't forget these people. These people deserve us. They do. They've given so much, and all their families and all their loved ones are grieving right now. They need you, West Virginia. They need your prayers. And absolutely, they'll be able to some way hear them. Please don't forget these people. Please don't forget them. We had 232 new positive cases in the last 24 hours, and that's great compared to where we've been. Our daily positivity rate was 3.13. That's great. Our cumulative positivity rate continues to fall, and it's at 5.43 now, and that's surely moving in the right direction. Our active cases are down to 6,451. That's 46 straight days that they've come down. Our recovered cases in West Virginia are 122,666. Look at that over there. Look at your recovered cases on the top, your active cases on the bottom, and look at how they separate and how they keep moving in the right direction. That's what we want. We want it to get wider and wider on our top graph. We don't have any counties in the state that are in red right now. We're down to 60 people in the ICU units, and we're down to under 200 people, 197 people that are hospitalized in our state. Look again at that map. Look again, and just think where we were. At one time, I think we had more than half of the counties in West Virginia that were in red. To go from red to green is an incredible movement. Look at that, West Virginia. We're getting better. We're getting better. Remember, all those that are 65 and above, if you have any kind of symptoms whatsoever, go get a test. It costs nothing. It is painless as it can be. Go get a test. It is absolutely free in every way. Go get a test. And we can get you these antibodies, and if your doc or somebody says, no, you don't need that and everything, if you test positive, you jump up and down on a soapbox screaming to the high heavens, you need the antibodies, and they'll save your life too. You know, guidelines that we have out, all businesses must continue to follow the safety guidelines. Also, our mandatory indoor face covering stays in effect. I have announced restrictions that we lessened in our small businesses, schools, and public gatherings a few weeks ago. I hope to be able to do another announcement on this coming Friday to where we're going to be able to maybe even lower those restrictions even more. We want to be smart, don't we, West Virginia? We want to be safe, and we want to absolutely maintain as much health as we can, but we got to keep on living. And absolutely, we got to keep on moving, what I call moving north all the time. So we're going to absolutely back up just a little bit more on these guidelines and everything and loosen them up just a little bit more, and I think it'll only be more beneficial to all of us. You know, all the documents and stuff are up on my website. You know, as far as the vaccine distribution update, we're at 96.5% of the first and second doses right now. Goal is always 100%. We'll get there by the end of the week. Still great work by all the people that are out there on the ground from the standpoint of the National Guard, all the health, clinics, and all of our community support and all the DHHR efforts and everything. Great work by all of them, and they have just knocked it out of the park and put West Virginia surely in the spotlight even more now. You know, I'm sure, and you know, I don't say this apologetically. I really pushed them and everything, and at the time, all I can say is I appreciate you responding to that push and everything, because I felt like this is where we needed to go, and you pulled it off. Now, as far as President Biden and everything, these companies continue to ramp up, and the Johnson & Johnson vaccine now is either here or on its way. You know, right behind all that, Pfizer and Moderna are significantly ramping up their production. President Biden just announced that every adult in West Virginia would have the opportunity to have a vaccine by May. Well, every adult in the United States would have the opportunity to have their vaccine by the end of May. That is real progress and everything. You know, again, I want to be respectful and thankful to our current president, but I absolutely always want to remember that our past president, President Trump, what a job he did. He absolutely deserves to be patted on the back. He put all this in motion and everything and deserves credit in many ways. To date, in West Virginia, we have now got in the arms of people 502,404 doses. 502,000, I just said. It is really, really a tremendous effort that has been all put together, with our health team and health experts and all the DHHR and National Guard, the community people, all the health clinics. It's just amazing what you've done, and I thank all of them in every way. West Virginia continues to lead the nation, and on top of that, I keep going back to this thing, ranked 7th in the world. If we were a country, to be perfectly honest, if West Virginia were a country, we'd be a pretty dadgum good country, and that's just all there is to it. But we're really proud to be part of the United States of America, the greatest country in the entire world. Now, as far as our vaccine allocation announcement today, and this is something that everyone should pay really close attention to, and I'm going to pause just 1 second and everything and just say, everybody dial into me right now. We are now going to move to lower our overall age from 65 to 50. And so from the standpoint of the prioritization, now it is going to include all West Virginians over the age of 50. And so we can just move faster to get to address the needs, and we will still prioritize those that are 65 and above. And so as we get this increased flood of folks out there that are now going to be eligible to get their vaccines and so on like that and everything, we still have some out there that are 65 and above or 60 and above. We want to put them, in the front of the line, and we want to be sure that they get their shots and everything. And so we will absolutely do that. From the standpoint of our education community, and I have promised this a bunch of times, I've said to you that we'd circle back on those under 50 years of age, from a standpoint of those people that are working in our schools, whether they be teachers or service personnel. I promised we'd do that. And what we're going to do now is we're going to circle back and begin vaccinating all those in the group from 40 to 50. We can't do them all right yet and everything, but we're going to get there, and I promised you I'd do that. And so for those teachers and service personnel 40 to 50, we're on the way, and we're going to absolutely start vaccinating you immediately. From the standpoint of our kids, that have really problems, that are out there, whether it be Down syndrome or it be intellectual or developmental disabilities, or caretakers that are working with of those with different problems, and whatever, from everywhere from organ or bone marrow transplants, or obesity issues, sickle cell anemia, cystic fibrosis, pregnancy, all those kind of things, and Dr. Marsh will be talking to you a whole lot more about that. But those that are 16 years of age and older, I think from 16 to 18, you can take the Pfizer, the Pfizer vaccine, or age above 16. Moderna and the Johnson & Johnson are 18, and so we'll be a little bit limited and everything, but we're going to jump back and try to take care of our kids, that have real health issues and everything, because we see them at risk too. So the long and short of it is, it's going to be pretty simple. We're going to go above 50 years of age. We're going to go to 40 to 50 for our educational workers, as well as our service personnel at our schools. And we're going to back up and help our kids that are having have real health issues and everything. Now, so I go back and, I can tell you again that, we're going to continue to prioritize the 65 and older, but we're going to move more aggressively to try to get more people vaccinated and everything, and widen the scope and everything, because at the end of the day, we're going to have more vaccines available to us, and we want to just keep pushing them and pushing them and pushing them out. Remember, the last thing on this planet that we're going to have happen in West Virginia is a bunch of vaccines sitting on a shelf. So we're moving as quickly as we possibly can, West Virginia, and we're continuing to run to the fire. People are tired, but so what? We're all tired. I mean, this whole thing, we've got this thing on the run, and we're going to chase it to the ends of the earth and get it gone. So, as far as our vaccine scheduling system and everything, we want people to continue to pre-register. We have now registered 320,000. Absolutely, it's working. So just continue to pre-register and everything. It'll only be helpful to you, and it takes less than 10 minutes to do it. And if you can't figure out how to do it, call us, and we'll walk you through it and everything, and we'll get it done. Just call us. I understand wholeheartedly. We got a lot of people out there that aren't tech savvy in this new age and everything. Just call us. Just call us. As far as our saving our wisdom clinics and everything, we're again in all 55 counties, and names are continuing to be pulled from our pre-registration stuff. And, I encourage everyone, especially everyone over the age of 65, to go online, register and everything where we can get your shots. Now just imagine this. And how many times have I been told, oh, now, Justice, that ain't going to happen. What you're saying ain't going to work and everything else. Well, let me tell you, I don't profess to be the smartest guy in the world, but I really do believe that the good Lord is in charge. I've got a lot of contacts all around this globe and everything, and I'm talking to a lot of people that governors in the past probably never had a chance to be able to do. I'm dialed into everything that's going on, I think, in a lot of different places. And so with all that, I said early on, did I not say early on that a lot of our folks would be able to get their vaccinations and everything by the March the 15th? Everybody sat back and said, no way. And I said, I know, you just wait and see. Well, the long and short of that is we began in January. Toward the end of January, we aggressively went after trying to vaccinate 80 plus, 70 plus, 65 plus and everything. People that really felt like there was no hope of them getting their shot until April. And lo and behold, today we are at 173,979 individuals over 65 and older, and we have absolutely shut this death rate down and shut it down fast. We got all of our nursing homes, but we got people out there that absolutely felt hopeless and didn't know where to turn, but we got them. And absolutely, we want to encourage all those 65 and older, continue to come in, continue to get registered. Absolutely, it will save your life. And the side effects and the downside, I surely don't have all the answers, but all I can go by is just this. For all we know, in all the medical communities all over the place, there is relatively no chance of a downside from the vaccine. And there's every chance in the world of an upside if you don't get it. So please, for the balance of our people that are 65 and older, you got to come in and get your get your vaccine. Our COVID vaccine info line is up there. It's got all the stuff on it, reminders about this. You're not going to grow antlers from the vaccine. I was really, really happy, to hear from Mark Curtis the other day about him getting a shot, because Mark's got some issues as far as health stuff, and as well as the media and everything, because they've got to be out there. They got to be on the front line all the time and everything. And so I was really happy that they are starting to getting their first round, and they'll get their second one real soon too. Just vaccine reminders is just remember, if you've gotten the Pfizer shot or the Moderna shot, it takes two. If you're getting now, maybe the tail end of this week, you're going to get a Johnson & Johnson shot. It is only a one-shot deal. Please don't forget, if you're Moderna or Pfizer, you have to have two shots. Everybody continue to use the testing that we have that's free and available to everybody out there. We appreciate Fruth and Walgreens so much on all their drive-through testing that they've done. It's an amazing effort by a lot of great West Virginians. We have 10 outbreaks in our long-term care facilities. It's amazing. It is absolutely amazing. Just no time ago, it was well over 100. That's a tenth. That's a tenth of where we were, and it was way over 100. So we have one outbreak in our churches. It's amazing. It's great, great, great stuff. Now, we all know in corrections, we've seen this. We saw it in the beginning at Huttonsville. We've seen it, have we not? Once it gets there, and it can come there from a variety of different ways. Primarily, it comes there from staff, or people that are on the staff, and they go home at night, and they go to Walmart, or they go here or there and everything. They end up with it. Some end up with it and don't have any idea that they've got it. They roll back into the jail facility, and lo and behold, it takes off like wildfire. You know, we got this thing down to where we only had just a handful of inmates and staff that had it, and boom. Now today we're at 170 inmate cases and 13 staff. We're at 87 at the Western Jail facility, and we're at 80 at the Southern Regional Jail. Now, you know, this is just normal as normal can be. We run to the fire. We try every way we possibly can to limit this and everything, but this is what this killer will do. And so we've got to stay on this and everything and get those inmates and staff, you know, at those facilities and corrections taken care of, and I'm sure that we're going to do that. Corrections has done an amazing job. Continue to wear your face covering. It's your first line of defense. Please give blood. West Virginia, come on, just keep at it. I think you're doing really good, but you can absolutely do more, especially if you've recovered from this dreaded thing. You know, please, you know, think of it as a blessing from God, and if you can give blood, go do it. Just go do it. You know, we're in now a state of emergency in 18 counties due to the heavy rainfall that we got and the significant flooding. You know, these counties have power outages and road blockages, and so you know, we'll be there. We're running to every fire, and we're there, and we're going to stay with it and get these people through this. The National Weather Service has issued a flood warning, you know, which continues until Thursday evening for the Ohio River, where moderate flooding is forecasted to affect Mason, Cabell, Wayne, Jackson, and Wood counties. You know, it's been a long time since I've seen the Ohio River, you know, at flood stages like we're talking about. So it's taken a lot of rain, but we've had just that. And the good thing is the forecast is showing relatively no precipitation in the next 7 days, but you know, and I know how we can depend on weather forecasts. They're amazingly good today, but you know, at the same time, you know, we got to stay on our toes here. We have a judge appointment today, and today I am announcing the appointment of Mary Claire Akers and everything of Charleston, West Virginia, to the 13th Judicial Circuit, which serves Kanawha County. She will fill the seat vacated by the death of a judge that we had a long time, a wonderful West Virginian, Judge King. Akers has practiced law in West Virginia for 21 years and is currently a senior assistant prosecutor in Kanawha County in the prosecuting attorney's office, and I have the utmost faith in Mary Claire. She's done an incredible job. She's an incredible judge or an incredible lawyer and everything. Now she's going to be our judge and our newest circuit judge in our largest county. So Mary Claire, go do it. Do your thing. I know you'll do great. And the only other thing I've got is we'll be back with our virtual town hall, and we're going to do that tomorrow evening at 5:30 in regard to the getting rid of our personal income tax. And any of your questions and whatever like that, send them to us, and we'll answer all of them we can as fast as we can go through them. Anyway, thank you so much. I appreciate you. I congratulate you, West Virginia. Please keep these folks in your prayers. 2,309 of them, and 9 of them since last Monday, and it's better, it's really, really tough on them. God bless all those wonderful families and all those wonderful West Virginians in every way. Thank you.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good morning. It's a morning full of new information, and I want to reinforce and perhaps talk just a bit to begin with on the amazing impact that we have been able to do through the governor's leadership and vision for our citizens. And as we prioritize saving lives and reducing illness and making sure that we maintain the capacity and the function of our healthcare sector and our community sectors, the strategy that we have taken with very rapid immunization of our nursing home residents and residents in assisted living, along with targeting our essential workers over 50, our hospital and healthcare personnel, and also our elders, has made a tremendous difference. I mean, the governor communicated that we have seen an over 85% reduction in the weekly number of deaths in the first 7 weeks of 2021. We have gone from 182 deaths the last week of December to 170 deaths in the first week of 2021 of January to last week where we had 25 deaths, which is quite remarkable. And as we've said many times on these press briefings, that we know our own data suggests that the older a West Virginian is, the more at risk they are of suffering really severe consequences, being hospitalized and dying of COVID-19, and that the average age of somebody dying of COVID-19 in West Virginia is 77 years old. 77.5% of our citizens who've died are over the age of 70, 92% are over the age of 60, and 97% are over the age of 50. So as we have seen more vaccines be allocated and be produced, it's very exciting that that we are able now to reduce the age for registration and for people being prioritized for vaccination down to 50 years old. And as I just said, that accounts for 97% of the ages of the people that have died in West Virginia. And we've also seen a precipitous reduction in hospitalizations. As the governor said, we have fewer than 300 hospitalizations right now, which is really terrific as well. So Jordan, if you could put up the slide. Good. I just wanted to go over this in just a little bit of detail. So importantly, starting to immunize our over 50-year-old population really does allow us to start to encompass all people in West Virginia that are responsible in the age categories for the deaths that we've seen. Again, the governor has read people that are younger, which is an important part I want to come back to here in just a second, but identifying those people, but still maintaining our discipline of immunizing our oldest West Virginians who have not been immunized first, and then continue to move down the list. But we really ask everybody to go ahead and register if you're in that prioritization group so that we know that you're there. And then, consistent with what the Centers for Disease Control recommends and the governor making the commitment to our educational sector, we have included now all pre-K through 12 from the primary schools, and then for higher ed, all of the teachers and service personnel in higher ed that meet those criteria, both from 40 to 50 years old, pre-K through 12 and higher ed, will be included in that group. And that will be reassuring, I think, for many people who are back in the classroom. As we've said, our epidemiology tells us the classroom is really safe to be in, but immunizing our older teachers and service personnel, and now being able to include our 40 to 50-year-old group, does provide an additional layer of protection for them in the classroom. And we're very happy to be able to do that. And all this is really made possible by the fact that we're seeing more vaccine. And as the governor said, we also are very sensitive to trying to make sure for our younger people, people less than 50 years old, who have severe illness or have a problem set that puts them at higher risk of being hospitalized or getting severely ill or dying from COVID-19, that group we want to include as well at every age. And as the governor said, we are limited because the emergency use authorization from the Food and Drug Administration for the Pfizer vaccine based on the clinical trial is 16 and above. And for the Moderna vaccine and for the Johnson & Johnson vaccine is 18 and above. And what we've targeted with this first group of priority diagnoses are individuals with Down syndrome, individuals who have intellectual and developmental disabilities, and if they require chronic caregivers for those West Virginia citizens and their caregivers. Also to incorporate West Virginians who've had congenital or acquired injuries or illnesses, for instance, neurological disorders that have created the inability for them to walk normally or sometimes even breathe normally, or brain injuries or strokes or other types of problems that keep them from being able to independently take care of themselves. So we want to make sure that they are eligible for vaccination and their caregivers. And then citizens in West Virginia that have received a solid organ or bone marrow transplant. Those West Virginians who are obese, and this is now medically obese, and we talk about this body mass index over 35, which for most people don't mean anything. But if you put it into normal terms, that means for a person who's 5 feet tall, a weight that's about 180 pounds or above, or for somebody 6 feet tall, a weight that's about 260 pounds or above. And this is important because these are people at much higher risk for hospitalizations and death from COVID-19. And then people who have sickle cell anemia, people that have cystic fibrosis, and then for women that are pregnant, because pregnancy is a risk area for us, and we want to make sure with the approval and the consent of the obstetric and gynecology experts that are taking care of you if you are pregnant, that we want to make sure that a vaccine is available to you. And we know that there are other diagnoses that people are concerned about. But I think with this group of priorities to add to what we've already done, and the fact we've seen such extraordinary outcomes from the strategy we've taken, this is really a move forward. And as we continue to get more vaccine, of course, we want to immunize every West Virginian that's eligible. But as we are able to open up these prioritization areas for people, we want to be very disciplined and pick those areas that have the highest level of evidence to suggest that we're going to save lives, reduce hospitalizations, and help West Virginia return to normal. So thank you very much.
All right, thank you, Dr. Marsh. Next to retired Major General Jim Hoyer, the Director of the Joint Interagency Task Force.
Good morning. As the Governor Justice pointed out, we continue to make good progress on our vaccine distribution. Our primary focuses right now are on continuing to overcome the challenges that some of our locations and counties had with the last couple of weeks of weather issues. We're balancing out, as we talked about, across our 55 counties, and we're close to having of that balance in place. We probably have a couple of counties will take us into next week to be able to get done. And based on the announcements that the governor's made, we're focusing future operations on being able to be more creative in how we address those populations that we need to get at. We also have an effort going on with our nursing homes that, again, is first of its kind in the country. We actually have a maintenance program going on with our nursing home facilities, both for incoming residents and staff, as well as staff who are now coming back to take the vaccine. And we were informed this morning on a call that that is the first of its kind in the country that's going on right now. So another effort that the governor's led us to be first in the nation to focus on critical population. We also have an effort going on as we roll out the addition to the age 50. We also have an initiative going on to go back and to make phone calls and other contacts with individuals 65 and above to make sure that those folks who are out there that we still have not gotten to, that we are putting an additional effort on making sure that we get to that population. Because as Clay Marsh pointed out, that is our critical effort, and that is what has led us to the numbers that the governor gave you earlier today. So we'll continue to sort by age, but we'll also be creative in our approach to get more vaccines out. Thank you.
Thank you, sir. Next to Secretary Bill Crouch with the DHHR.
Good morning, everyone. Just to show how vaccines are helping our nursing homes, several weeks ago we had an outbreak in a facility in West Virginia. All of the residents had been vaccinated, and as a result, no residents were positive in that outbreak. This is a direct result of the governor's priority to our elderly in West Virginia and making sure that they were tested first. We were the first to vaccinate all of those folks. Interestingly, of the 60 staff members, 7 chose not to take the vaccine. All 7 of those individuals tested positive during this outbreak. We saw a 93% reduction in the number of nursing home outbreaks from December to February. We had 57 outbreaks in December alone, and in February we had 4. Vaccines work. We're asking nursing home staff, new staff in nursing homes, and staff who have not been vaccinated to please get your vaccination, get your vaccine through the facility. You can talk to the administrator who will assist with that. As Jim mentioned, we've set up a maintenance program to make sure residents going into nursing homes and staff are vaccinated. We thank the West Virginia Healthcare Association as a great partner in developing that maintenance program and making that work. So please pre-register for your vaccine. Take it when it becomes available. It is safe and it works. Until then, wear your mask and stay safe. Thank you.
Thank you, Secretary. Next to Dr. Aina Amjad, our State Health Officer.
Good morning. Just to remind everyone to wear their masks. We have been talking about the vaccines and how important it is. It is a reminder that while you're waiting to get your vaccines, to continue to wear your masks. We are getting questions, even if you've been vaccinated, to continue to wear your masks and social distance. We get questions about wearing double masks. While that is important, we also want to remind you to wear a well-fitted mask to make sure you're covering your nose and to make sure it's fitting around your chin comfortably, but to continue to do that while you're waiting for your vaccine. So thank you very much.
Thank you, Doctor. We'll now go to questions from members of the media. The first today from Kenny Bass with WCHS and Fox 11.
Hi, this is Kenny Bass, Channel 8 and Fox 11. First off, Governor, I think our meteorologists have done a great job forecasting the rain and the flooding. So good job to Doug Harlow and Brandon Stover and Alex Cordero. I give them a hard time, but they've been working hard like the other weather guys and weather women in the market. Really quickly, congratulations to Governor Justice. She'll be on the panel with the Hill tomorrow nationally talking about the vaccine effort in West Virginia. So congratulations due there. Good luck tomorrow during that panel. And a question for General Hoyer. With adding these new groups, General, is it a good time to very quickly go down the list of how the vaccines are handed out to each county, the prioritization lists that the state prefers that people use, so that people don't get upset when they anecdotally hear of others who get the vaccine that they believe perhaps have jumped the line or aren't as seriously in danger as an older West Virginian. So could you pretty clearly delineate how those shots are being handed out? Thank you very much.
Before we go to Dr. Marsh, Kenny, listen to me on this. Now, you know, I'm almost saying in jest about the weather, but the one thing that I can say is thank God above, you and I are not the meteorologists and everything and are taking care of the weather forecast. But I always say that teasingly and everything. I think you do great work and all that. And But you know, the people that are out there on the front lines, and they are giving us our weather forecasts and everything, they have through time and everything, they have really displayed their talents. And so I agree with you. I agree wholeheartedly with you. But Dr. Marsh, if you'll answer Kenny's question, please.
Governor, if it's okay, I think General Hoyer may be better.
Okay, I'm sorry.
So thank you. So Kenny, we have an imperfect system at best. So we know we're going to have folks out there that we miss in or some form or fashion. But priority focus as we go forward is still to sort the list that we have by age, so that we're working that. There is an initiative going on this week that will call directly as many as 11,000 West Virginians to go back and double check to make sure that those people and those age populations have had the opportunity to get the vaccine. There are some cases where folks have gotten the vaccine and they were on multiple lists and were not annotated in a second list. So we continue to work that piece. We'll focus on that. We work with the counties each week, and there are multiple calls and discussions with the counties. And then we give direction out to those pharmacies that are participating in the program. So I think we'll continue to focus where we need to get to. I would encourage anyone who is in the age group that has not received a shot to call the hotline and give us their information. And that gives us one more outlet valve to be able to check to make sure we get to people appropriately. Thank you.
All right, thank you, Kenny. Next to Charles Young with WV News.
Hi, this is Charles Young with WV News. My question's also for General Hoyer. I've heard you say before that the upper end of the state's vaccine capacity per week was 120,000. Now that our allocations keep going up, do we have an idea of when we'll get to that number? And has that number gone up at all as we've continued to build out the distribution network? Thank you.
Yeah, so Governor, if it's okay, I'll go ahead.
No, please, go.
So Charles, we are at a base level now of about 60,000, and that number fluctuates. The good news is that number will fluctuate up, and it is all dependent upon a variety of things that come out of Operation Warp Speed. Just to give you an example, in the last 24 hours, we've received 3 different numbers on potential increases, and one number that told us that the Johnson & Johnson vaccines that we received, 15,500, will not be for a single week, but will be for multiple week period until we can make another order. So we continue to manage that piece. In total this week, with both first and second doses, we will be right at administering 100,000 vaccines. So clearly we're in a position based on what we had described earlier. The next thing we're doing as we roll out these changes is we will be, and part of that future operations work that I talked about is the interagency task force is working with different providers to be prepared to help us administer vaccines going forward, but also to identify those populations of people that may have not registered in the system that we still need to get to. So we're pretty comfortable where we're at. If I gave you a number of how many vaccines we're projecting to get today, probably by the end of the press conference, I'd have a wrong number because it changes that frequently. Thank you.
All right, thank you, Charles. Next to Mark Curtis with Nexstar Media.
Good afternoon, Governor and cabinet members and fellow members of the media. First of all, Governor, thanks for the shout out about my shot on Sunday. I forgot to mention the other day that I got it at the Walgreens in Clendenin, and I want to give them a shout out and mention Marin and Tracy, the 2 young ladies in the pharmacy that did such a great job, very professional. And I mention them because this was a store, that pharmacy there, that was flooded out and pretty much destroyed in the 2016 floods. And obviously they're back on their feet and doing an excellent job up there in Clendenin. Governor, my question is specifically, oh, by the way, no antlers yet either. Governor, my specific question is, the states of emergency, what kind of services will that enable these 18 counties to get? What additional help will they get? Will you ask President Biden to declare them federal states of emergency so some federal money can come in? And in answering the question, I also want General Hoyer to address what I asked about the other day. In these 18 counties right now, are we having any trouble getting the vaccine or the testing done because of the aftermath of the severe weather?
Okay, Mark, I'm tickled to death. You mentioned Marion and Tracy because they called me after you got your shot and they said, we had to take care of Mark for a little while and everything. He was crying a little bit and everything. His arm was hurting, but I'm just teasing. But Marion and Tracy, great work. From the standpoint of what we're doing, the services that we're already on this in every way. We're providing services from the Guard and our emergency services people, our emergency management people. We're asking President Biden to declare these counties as disaster counties, that will, free up all kinds of FEMA possibilities and aid and everything in lots of different ways. But General, maybe you can take it from there.
Yes, sir, Governor. And Mark, we are seeing some challenges in those 18 counties. We had some counties that were still dealing with the ice storm piece. Their emergency management teams and their local health departments have to now respond to multiple issues. So we work with those counties to balance out capability. But as the governor pointed out earlier, 96.4% of total doses administered. We think by the end of this week, no later than the end of next week, as they're able to stabilize through these weather response issues, that we'll be back on a good footing with all 55 counties. But we've got to be prepared each day to respond to all kinds of things that will impact our ability to get shots out.
All right, thank you, Mark. Next to Paul Mullen with WCBC.
Good morning, Governor. Good morning, panel. Governor, I'm not breaking any news here when I say West Virginia is built on the backs of small businesses. And during this pandemic, a lot of small businesses have gone out and others have just hung on by a thread and used up any reserves that they may have for a rainy day because it's been a year-long rain. Are there any plans in the state of West Virginia to help these businesses start to thrive again once we get out of the pandemic, whenever that may be? Have you had any discussions with lawmakers, with your cabinet, on how to get business going again?
Well, Paul, we've had all kinds of discussions, and it would be impossible to go through all the points here, but I can just tell you simply this. We tried to provide some level of relief, and we did, to our small businesses from the standpoint of our CARES money and our state, from being able to step up and do that, on the CARES money we got before. There is additional stimulus coming. There is PPP that was available to our small businesses in the beginning, and a second round of PPP was available to our small businesses as well. So people that applied in the very beginning, they could turn around and apply back. Now, that doesn't mean, that our small businesses haven't hurt, and that doesn't mean that our small businesses aren't, people haven't gone out and done everything, borrowed money themselves, done everything in the world to keep the doors open. Some of our small businesses, frankly, have just gone under in the whole process. Now, the additional dollars that we have coming, the things that we can do for our small businesses in every way, in my opinion, is just absolutely just this. Today, we have an opportunity. We have an opportunity beyond belief. We're going to have substantially more stimulus dollars come. We can step up and help our small businesses again in lots of different ways. From the standpoint of just this, and Paul, just stay with me just a second on this. And I'm not going to sit here in the middle of this briefing and market the getting rid of our personal income tax. But I know as well as I know everything about me, and it's just this. It would drive opportunity and business to this state beyond belief. It would drive jobs here. It would drive growth in your paychecks and the ability to get a better job or a higher paying job. All of those things could come and would come with absolutely us moving and acting. And today or tomorrow at the latest, my bill is going to go to the legislature. We need them to act, because my bill is going to be a bill in which every single West Virginian is going to be able to put more money in their pocket immediately. Immediately, more money in their pocket as soon as we move forward to reduce our income tax in West Virginia. And in addition to that, all the opportunities, from your property values going up to your wages going up to all the different people that could come that will live and reside in this great state. Paul, just think about it. Just think about this. The population in the United States of America has doubled since 1950. In the state of West Virginia, we're the only state in the country that continues to lose population and lost population during that time. Paul, just think. What if West Virginia's population was 1,700,000 then, and today we had doubled like everybody else, and we were 3.4 million in West Virginia? Wouldn't things be so much better for our small businesses and opportunities and things that we would have in West Virginia that maybe others wouldn't have? I mean, Paul, come on. I am absolutely trying to take you there. I don't mind dragging people, but along the way, I'd love if I wouldn't have to drag them with the chisels down. I mean, come on, come on. And all of us need to be encouraging our legislators to get on board. I'm going to do this in a way that is absolutely as painless to our people as it possibly can be, net money in their pocket, and right behind all that, absolutely an opportunity to bring so much goodness to this state. We're right at the steepest part of the mountain. We got to go on and get across.
All right, thank you, Paul. Next, we'll go to Brendan Tierney with WSAZ.
Hello, Brendan Tierney with WSAZ News Channel 3 here. I have two quick questions today. First, if you could clarify some information on the expanded age range for the vaccines. Is it going to continue to be by when you register when it comes to that prioritization, or would a 55-year-old who registered today get their vaccine before, say, a 50-year-old who registered on the first day that the online system became available? Then I was also, Governor, you'd mentioned what President Biden announced yesterday, that the whole nation, every adult will be vaccinated by the end of May. Is that on track with what we're expecting to see here in West Virginia?
Let me do the second part. You know, Brendan, if we get the vaccines, we have led the nation, and if we had the vaccines today, you know, we'll beat that into May by a long shot. Just having the vaccines is the biggest problem. But you know, we're getting really close to where we're going to have a flood of vaccines available. I've said it over and over. Have I not? You know, when I've said, you know, that really and truly, we're going to awaken to a situation to where when we awaken to that situation, we're going to have additional vaccines come, and really at that point in time, we can really move. Now, from the standpoint of the first part of the question, I think, you know, maybe Secretary Crouch or someone's going to have to answer that rather than me about how they go through the registration stuff. But, you know, somebody, General Hoyer or Secretary Crouch or somebody.
Yes, Governor. Yeah, Governor, happy to do that. We have a priority in terms of how these lists are prepared, and date is still important. We, as we've said for a couple of months now, actually, age is the primary factor in terms of these vaccinations. So we're working real hard to try to make sure those lists get out properly. We've also talked about pushing the African-American population out, then age over 80, age over 70, 65 and over. Teachers, now we have a new list that we're looking at. Those individuals will be added to those lists that go out to counties. But the date that information and that people register is still important in terms of pushing those lists out. So thank you for the question.
All right, thank you, Brendan. Next, we'll go to Mark Cram with WDVM.
Well, good morning, Governor. Good morning, General Hoyer and Secretary Crouch and our esteemed doctors there. I have to say that recently I was able to get my shot, the first shot, in Berkeley County, it was a well-oiled machine. With all the volume of people in there, you still felt very safe in regards to the distancing, and remarkably how quickly they got it done. So very good work. It's good news that you're expanding the age. I've heard a surprising number of people declare they're simply not going to get the shot. We know every year that there's quite a large percentage that don't get the flu shot. What's the potential impact if, say, 20 or 30% of the population simply refuses to take the shot? What's the potential for our future there?
Well, first of all, congrats on getting your shot, and I love it to hear that Berkeley County was running like a well-oiled machine. You know, they do great work there, and I congratulate them over and over. From the standpoint of people not taking their shot or not taking advantage of getting the vaccine, look, you see how some people, you know, behave or act, and some people are, you know, whether it's a macho move or whatever it may be, you know, I want people to always have the rights to be able to do what they choose to do, but in this situation, as they choose not to do this, they're endangering themselves, but they very well could be endangering others, and so I just want them to really think about this, and really think about this in a really, really profound, good way, because at the end of the day, they need to take their shot. You know, that's just all there is to it. But Clay, maybe you can answer better than I.
Well, thank you, Governor. And I think that this is a really important point that we want to re-emphasize so that we know we've seen extraordinary benefits to our citizens that is really created because of the amazing speed and the effectiveness of the vaccines that we've been blessed to receive. And so as we look at variant viruses coming to West Virginia, we know that the number one way to stop the mutations, the variant viruses from gaining a foothold here in West Virginia is stopping transmission, because if the viruses can't infect people, then they cannot spread in West Virginia. And that makes it even more important right now for people who are eligible to and prioritize to get their vaccine to please choose to get your vaccine. These are remarkably safe vaccines. We've all had it. You know, it's great that we're seeing this being able to be expanded in West Virginia, but it is really of absolute urgency and amazing importance that people do choose to get the vaccine. It saves lives, it reduces transmission, it stops those variant viruses from growing. I'd also like to take one pause and pivot really quick to also point out, which I forgot to do in my opening comments, that for those West Virginians that would qualify because of the medical conditions, then we will ask the hospital systems, the primary care networks to reach out to you if you're included in these systems. But also please don't hesitate, if you're one of these folks, to call in, either to pre-register in our system or to call in the hotline number and make sure that you are entered and prioritized so that we know you're out there, because some of these are perhaps not exactly, you know, a medical illness only. This is a set of different types of problems or challenges, and we want to make sure that we get vaccine to you in a very, very efficient time manner. So thank you very much.
All right, thank you, Mark. Next to Suzanne Elliott with the Dominion Post.
Hi, I had a quick question. Why are doses of the vaccine in Mon County being halved, the amount? And are other vaccines that other counties getting, or is the amount being halved as well?
General, you've got to answer this, sir.
Yes, sir, Governor. Yes, ma'am. As we talked about in the last two press conferences, we had 28 counties that were not meeting the threshold of the 15.1% that we'd set for people over the age of 65 and total population in those counties. That required us over a 2 to 3 week period to balance out across the various counties. That should be complete by next week. And as that is completed and additional doses come in, you'll see those numbers ramp up. But it goes back to the bottom line is this. We had 28 counties where we had people over the age of 65 who we were not getting enough doses to. We know that population dies at a much greater rate than the rest of the population. And we had to make this adjustment in order to continue to see that trend that we now have of death rates going down and hospitalizations going down.
All right, thank you, Suzanne. Next question from Phil Kabler with the Charleston Gazette-Mail.
Hello, everybody. First of all, as a longtime resident of Charleston's East End, Governor, I'd like to welcome you to what I consider to be the best neighborhood in West Virginia. My question is, President Biden yesterday called on all states to complete vaccination of all teachers and school service personnel by the end of this month. Do we have a plan in place to accomplish that?
Okay, General, you're going to have to answer the tail end of that. I'll come back to first.
So, Phil, as was pointed out earlier, we're going to now go to teachers in the age range 40 to 50. And as the balance of the vaccines come in and we go to the populations that we need to get to, we'll continue to work that. Not just teachers, but we've got a number of essential workers across this state who are in the same situation. And again, I go back to my answer to the last question. We know the target populations that lose their life the most from this, as well as go to the hospital the most. And we've got to continue as a state to focus on that number.
And Phil, all I'd say is I agree with you. Eastern, Charleston area is a great area, as well as all the areas across this wonderful state. It's an incredible, incredible state.
All right, thanks, Phil. Governor, I'll turn it back to you.
Okay, I've just tried to make myself just a couple notes. The only thing that I would say is, General, I was really impressed by you saying some form or fashion there. That was really great. And Marion and Terry, at Clendenin or wherever, I didn't get exactly this location where you were taking care of Mark, and I really appreciate you pulling him through this. And the only other thing that I would say is, along the way, we're riding a little bit of a high right now, and we're happy, about all the progress we're making. I caution everybody, don't drop your guard. Don't drop your guard, West Virginia. If you go back and you remember when I was sitting and I was saying to you over and over, we have to find a way to bridge ourselves to a vaccine. Well, we did that. Do you remember those days when over and over I said exactly that? We've got to get ourselves to this vaccine. We've got to protect ourselves as best we can. We've got to protect our businesses. We've got to get ourselves to this vaccine. We did it. We did it, West Virginia. Now we got to finish the deal. And to finish the deal, we can't slip back. We can't drop our guard right yet. Now come on. We're really close. I'm really proud of you in every way, and really, it's been a real honor. It's been a real honor. It's been tough, and a lot of sleepless nights and tons of prayers, but it's been an honor to be right with you. From the Air Force, a lot of them would say it's been an honor to fly with you, and it really has been. Thank you so much, West Virginia. Keep it up. Keep a good work. Don't drop your guard.